Suicide can affect anyone, regardless of race, age, or gender, and there are ways to reduce the number of lives taken. Joining us to talk more about this are Michelle Pearson. She's the program manager at Integral Care's Del Valley school-based program, and Felicia McBride Rivers, a parent and community member. Good morning, ladies. Thank you so much for being with us.
Morning.
We just went through National Suicide Prevention Month in September. Coming up later in October, we've got Mental Health Awareness Day. So this is something that we should continue to talk about, because today's conversation could save somebody's life. Michelle, do you want to tell me a little bit about how you and Felicia are connected, or how you guys met, and why you're on the couch together today?
Well, we were actually recently on a panel talking a little bit about just the return to school and families thinking about, hopefully, mental well-being and how essentially it impacts all of us in one way or another. And I know Felicia, being a parent, had some wonderful insight to share about her experience with her family.
We were talking before, when we were in commercial break, a little bit about your daughter, who is in recovery right now. She's in treatment, so she's getting better.
Yes, she's getting better. It's been a difficult road. It's been very challenging.
How are you?
I'm doing well. There's a lot of support, and I'm very thankful for that. And it's just it's a lot that goes into it, and there's a lot of patience you have to have, and try to understand, like, look at it outside of being the parent, which it can be challenging.
Right, because you're so emotionally connected. It's your child.
Very, very much so, and you always want much better for your children, you know, all the time, much better than maybe what you feel like you've had. And sometimes there's just like some bumps in the road.
Michelle, as I mentioned in the introduction here, you are the program manager for Integral Care's Del Valley school-based program. What was the onset of creating this program in the school district, or with a school district?
So the idea was putting a mental health professional in every school, ideally. When we first started this program, there were some of us that were in multiple schools, so just trying to get as much support and coverage in schools as we could. The model that we've been able to do in Del Valley is having a school-based therapist on every campus that works closely with the school team, with the school counselor or the school social worker, as well as the teachers, and identifying students who need additional support. And so it's been a model that's worked well. We just wish there was more of us, because the need is great.
Felicia, you brought a little deck of cards here. It says ask, listen, talk, repeat. What exactly are these cards? And these are from the city of Austin. We've got talk on the screen.
Yeah, okay.
No, I mean, you don't have to go through it for us. That's not what I meant. But more so when we've got these cards, or if a parent is able to pick up some of these cards, tell me what they're for.
They're for starting a conversation with your child. They're both, it's in English and Spanish.
Oh, that's great.
And quite honestly, I really wish I had them. My daughter is going to be 27 here in a couple of weeks. But I really wish I had them when she was like 12, 13, 15, 16, because it just snowballed, you know, as she got older into her adolescent years. And everything on there, on these cards, I had to figure that out on my own. I really wish I would have had those cards. They're really, really good for starting a conversation when you have no idea how to start that conversation.
Because there's no handbook for this.
Right, there's no handbook for it, and it's not a cookie cutter situation where one technique works for everyone. So,
Michelle, we always like to let our viewers know that there is help out there. Where can someone reach out if they are in crisis, if they are in need?
I think one thing we try to do in the schools, you know, I work on a wonderful team of school-based therapists and mental health providers, is help families build a community of support in their community. So knowing who their school counselor is, knowing who some of their trusted teachers are, knowing who the school, if there's a mental health professional on your campus. I know AISD recently talked a lot to families about what is in your community. So knowing what those resources are, and also helping students be connected, you know, So they aren't in isolation
Right,
when
so they
there
don't
is an
feel
issue.
alone. Right.
Absolutely.
So they can trust someone.
Absolutely.
And to go talk to.
Now, there, of course, are additional
Right.
resources when there's crisis support needed. Integral Care is one resource. 988 is also
on our screen there we have the National Suicide Prevention Lifeline. You can call or text 988. Ladies, thank you so much for joining us and sending out this message. We really appreciate your time.
Wonderful. Thank you.
We'll be right back.